This presentation is on a study which investigated the placebo effect on upper and lower muscular strength and endurance. Placebo effect is defined as a beneficial effect produced by a placebo drug or treatment, which cannot be attributed to the properties of the placebo itself, and must therefore be due to the patient's belief in that treatment. The placebo effect has been predominantly studied in the medical field, with positive impacts being proven for conditions such as pain, anxiety, and Parkinson's disease. It is only recently that the placebo effect has been actively studied in regards to athletic performance and physiological benefits. Studies completed have mainly focused on cycling, running, and weightlifting, with a small to moderate improvement in performance which may be attributed to the placebo effect. The majority of studies which focus on the placebo effect in regards to athletic performance have tested the presence of a placebo effect with the use of supplements and performance enhancements. There have been few studies where only a placebo has been used. In general, the existing research has mainly been used between mixed subject design, where one group has been given a placebo and the other hasn't, which increases the variance of the study due to the individual's responses to the placebo effect. This has been identified as a weak point in existing studies and has been identified that completing a within-design trial will potentially reduce this variance. Previous studies have not recording the nutritional intake of subjects across the design. To broaden the scope of studies on the placebo effect, this study will use the placebo only, be a within subjects design, and will record subjects' nutritional intake across the study to reduce the variance of this impacting the results. This is an outline of the methodology of the study. The subjects were 15 college-aged, apparently healthy male volunteers. Subjects were first screened to confirm that they met the criteria to participate in the study. 4 tests were used for the study, which was completed over 4 visits, 4 days apart. A 1 RM bench press and 1 RM squat were used to test the strength. The number of reps completed at 80% of the subject's 1 RM weight for squats and bench press was used to test endurance. The first visit entailed the subjects completing their informed consent and a practice round for each of the tests to ensure their exercises were completed correctly. The subjects were also given a food diary to complete over the next 3 days prior to the second visit. During the second visit, the subject's demographic data was recorded and 1 round of each test was completed to record a baseline for the study. The subjects were then given a sugar tablet to take over the next 3 days and told that it was a supplement that composed of a powerful amino acid compound that has been proven to increase skeletal muscular strength and endurance by 10 to 15%. Subjects were then given another food diary to complete over the next 3 days prior to trial 1. During the third visit, the subjects completed trial 1. This was another round of tests in which the results were recorded. On completion of the tests, the subjects were informed that another university had just completed an independent study of the supplement and found the supplement to have no effect on skeletal muscular strength or endurance. The supplement does not work. Subjects were then given another food diary to complete over the next 3 days prior to trial 1. The final set of test was completed by the final round called Trial 2 to identify if there had been any changes between Trial 1 and Trial 2 and if there was a significant difference from the baseline trial. On completion of the study, the subjects were informed of the true intent of the study and that they had been administered a sugar tablet for the entire study. The mean of the subjects' results for each trial is shown in the graphs. Paired t-tests between baseline and Trial 1, baseline and Trial 2, and between Trial 1 and Trial 2 were completed to identify if there was a significant difference between each trial or each test. A significant improvement was recorded between the baseline and Trial 1 and the baseline and Trial 2 for the 1 RM squat, the 1 RM bench press, and the number of reps at 80% of 1 RM for the squat tests, showing that a placebo effect was present. No significant difference was recorded between Trial 1 and Trial 2 for these tests, showing that the placebo effect was carried through to Trial 2, even though the participants knew that the supplement had been proven not to enhance performance. The bench press endurance test showed no significant difference between baseline, Trial 1, or baseline and Trial 2, and this test was considered an anomaly for the study. The mean of the subject's nutritional intake across the trials is summarised in the table. There was no significant change across the 3 trials, and the study has concluded that the subject's nutritional intake did not impact the results. A significant difference for 3 of the 4 tests between baseline and Trial 1, so it can be concluded that the placebo effect was present in this study. This is consistent with existing research where the placebo effect of supplements have been found to exist, providing improved performance. In addition, the results confirmed the hypothesis that the subject's performance would not be significantly different between Trial 1 and Trial 2, even though the subjects were aware that the compound did not improve performance. This is not consistent with the previous research where a significant decrease in performance was shown when the subjects were informed that the supplement did not enhance performance. Proving the placebo effect has significant implications in a number of areas. In research, proving that the placebo effect can have a significant impact on results for trials for medication or performance-enhancing supplements increases the risk that a percentage of results may be due to a placebo effect rather than to the medication or supplement. Often a control group is used for these trials to reduce the variance due to the placebo effect. In the supplement industry, the supplementary industry leverages on the placebo effect, where some manufacturers will advertise the effectiveness of a performance-enhancing supplement, knowing that more often than not, reported improvements are due to the placebo effect and a user believing the supplement will enhance performance. Performance-enhancing substance use. The final area where the placebo effect is an important consideration is for using performance-enhancing substances for elite athletes, where many enhancing substances are illegal. The placebo effect can be effectively utilised by coaches and sports psychologists so that athletic performance may be enhanced psychologically rather than resorting to illegal substances. From the outcome of these results, it is recommended that further study into the placebo effects and the psychology of athletics' responses is studied